What do you think is the perfect exercise for low back pain, according to science? In this video, we'll explore many common physical therapy exercises for low back pain and sciatica and figure out which of them is the perfect exercise. Oh, and I'm gonna make you put your critical thinking hats on and look at research, because many of you are scouring the internet looking for the one exercise to rule them all. But you've tried everything. You've tried core stabilization exercises. Maybe you found Dr. Stu McGill and somebody told you never to bend your spine, so you brace your core and avoid bending at all costs. You've probably tried some hip mobility drills, 90-90 position, maybe a pigeon pose to loosen up the hips, or stretching exercises for the hamstrings, or the piriformis, or the hip flexors, or maybe you went with the McKenzie method and you're doing all kinds of back extension exercises to centralize the pain. Well, let's take a look at each of these concepts for exercise-based rehabilitation for low back pain and sciatica. And let's figure out which of these is the perfect exercise for you. More importantly, let's figure out if there even is such a thing as a perfect exercise. And I think this is going to give you a ton of clarity as to why the exercises you're trying at home are not working. So first up, let's talk about core bracing and Dr. Stu McGill. First, I want to say Dr. Stu McGill is amazing. I even had an opportunity to interview him when I was running several student clubs back when I was in school. Great guy. But there are some major issues when people start taking his advice too seriously and too literally. So let's look at a couple of his exercises. You may have heard of the McGill Big Three. This involves a modified curl up, core stability, where you don't move your spine, a side plank hold, again, core stability, don't move your spine. And of course, there's the good old bird dog exercise. Yet again, core stability, you don't move your spine. Now, there's nothing wrong with these exercises, but I can think of dozens of examples of patients for who these exercises would just never work. But first, I just want to point out, basically his solution to low back pain is don't ever move your spine, which makes zero sense because the way that joints heal is with movement. He's a biomechanics researcher. All he's talking about are the forces that are on the spine. That doesn't tell you anything about how a living, breathing organism heals over time, and it doesn't tell you anything about how pain actually happens in the individual. So who would these never work for? Well, I'll give you one example. How about a new patient of mine the other day who can't even get up and down off of the floor? How are they going to do those exercises, right? And it's not the same to just say, oh, well, just do them on a bed. It's not the same exercises. There are better answers. Next, and more important, is that all these exercises are teaching patients that they should never move their spine. This is terrible advice because we have tons of research showing that bending your spine is perfectly safe, even in sports that load a bent spine heavily. And yes, of course, bending your spine can be really sensitive for some people for a certain amount of time, but the goal should not be to avoid moving the spine forever. The goal should be to slowly ease your way back to normal, because a healthy spine should be able to bend and twist in every direction. So Stu McGill's stuff could be really useful when you're in severe pain, but it's definitely not a long-term solution. And in fact, if you take it too seriously for too long, it can lead to a very bad long-term outcome where you have fear of pain and you stop moving and things get worse. Now let's talk about hip mobility exercises. Should you be worried about hip mobility? Well, the argument goes that if you're bending over and you can't get your hips out of the way, you've got poor hip mobility, then your lower back is going to have to compensate and round while you're lifting. So the proposed solution is just doing pigeons all day, I guess, instead of just strengthening the spine, which is stupid. Flexibility will always be less valuable than strength. I mean, the stretches are fine, but we really need to debunk this myth right now. Research shows that when you're trying to bend over and pick things up, even if you're trying not to round your spine, you always round your spine. In fact, some weightlifters in this study right here showed upwards of 40 degrees of spinal flexion, i.e. forward rounding, even when they were trying to keep their spine neutral. Oh, and by the way, that's a McGill study right there. So the attempt to keep the spine neutral is impossible in the first place. So I don't think that hip mobility is a silver bullet for anybody. So now let's talk about stretching exercises, because I know you've been told to stretch your hamstring. I know you've been told you have tight hip flexors, or that you have piriformis syndrome? Well, let's look at the research. So is it important to have flexible hamstrings, for example, in order to prevent low back pain and sciatica? Well, this study showed no correlation between sit and reach scores, or hamstrings flexibility, and low back pain. Here's another study showing the same thing. Hamstrings flexibility does not matter. And here are 3 more studies showing absolutely no correlation between flexibility and onset of low back pain, even with one of these studies looking at a 25-year follow-up. Okay, but why doesn't flexibility work? Why doesn't stretching work? Stretching doesn't work because it doesn't do anything to make you stronger. If you want to reclaim the active life you love, you need to get strong and resilient. That's the reason why physical therapy so often will plateau in terms of progress. They baby you with bands and foam rollers and balls and shit that doesn't make you strong. A little stretch and a bend is not gonna cut it. You can't go wrong getting strong. But beyond that, we can't reduce something as complex as chronic pain down to a hamstring stretch or a piriformis stretch. We need to address the non-physical aspects of pain, like fear, anxiety, stress, and depression, especially fear of pain. I say this all the time. I quote this study all the time. Fear of pain is more disabling than pain itself. So now that we've reviewed many of the common exercises for low back pain and sciatica, let's talk about the real perfect exercise for low back pain and sciatica. By now, it should be obvious that there is no perfect exercise. So the idea that you're just going to fix your low back pain or sciatica and it's just one video away. Oh, it's the next clever exercise. Sorry, that's not how it works. There's no such thing as a quick fix. So as long as you keep thinking that the reason you still have chronic pain is because you haven't found the perfect exercise, you are going to be stuck on a wild goose chase forever. So the real perfect exercise is not a specific exercise. It's not this exercise versus this exercise. It's the perfect amount of exercise. Because if you do too little for too long, your body gets weak and you're more easily injured. But if you do too much too fast, then you skip steps, you do things you're not prepared for, and of course you get injured. And this is why chronic low back pain and sciatica can absolutely wreck your body, because you're either getting weaker and suffering from atrophy, or you're skipping steps and getting injured that way. And this leads to a vicious cycle of deconditioning. So if you want to know how this cycle happens, watch the next video. I made a video on how low back pain wrecks your body and how to stop it. So watch that video next, and I'll see you there.